Hello, I am Chloe, and I have cerebral palsy. Surgery to straighten the legs is one of the main ways of treating young people with CP to help them walk better. After the treatment, the hospital team look at what effect the treatment had on children and young people. For example, they measure how fast or how far the children walk, how straight the legs are, or how quickly they healed. These measurements are called outcomes. The problem is that doctors don't always measure the outcomes that are important to children with CP, like me. You can imagine that if each hospital team is measuring something else as an outcome, there is no way we can find out which treatment works the best. For example, Dr. Ali might be measuring your speed when walking, and Dr. Smith measuring your pain as an outcome. These outcomes can't be compared and don't add up. They are like apples and oranges. We can help solve this problem by using something called a core outcome set. A core outcome set is a recommended minimum set of outcomes that covers the most important health areas that are relevant for everyone. This means that the children and young people with CP, their parents and carers, and the hospital teams treating people with CP, and researchers all get together and agree on what should be measured for surgery to the legs. Recently, I took part in a core outcome set study on surgery to the legs for children with CP. Other people with CP took part too, along with parents, caregivers, health professionals and researchers. Everyone had a say in what is important to measure after surgery to the legs. John is one of the doctors who organised the study and is here with me now.
Hello. In our project, more than 150 people from 16 countries worked together to develop a core outcome set. They took part in an online survey called the Delphi survey. They were all given a list of outcomes to score. They were asked to score how important these outcomes were to them when making decisions about treatment to the legs.
After the voting, a smaller group including people with CP, parents and experts, attended a meeting. We reviewed and discussed the results of the survey. The core outcome set was agreed by everyone.
We developed the core outcome set taking into account the views of all group members. We agreed on 8 most important outcomes. These must be measured in future research looking at surgery to the legs for children with CP. So if we are looking at the results of surgery to your legs, we will need to measure 1. If any pain, discomfort and fatigue improved after treatment. 2. If the shape and alignment of the legs improved. 3. If balance improved and falls reduced. 4. If you are more able to do your usual daily activities. 5. If your walking ability has improved. 6. If you are more able to participate in physical activity. 7. If you are more independent. 8. If treatment affected your overall quality of life. We also agreed on what tools to use to measure the core outcome set. For example, we can use computers to measure how you walk with gait analysis. We can ask you and your parents to fill in questionnaires. We must not forget to always record everything that goes wrong after operations, such as infection or delayed healing. When we study the results of surgery, it is important to know how often an operation causes unexpected problems.
We now have a clearer idea of what is important to measure after surgery to improve the legs in children with CP.
If you are doing research in this area, we recommend you should use this core outcome set in your research.
And if you have CP and you have been invited to take part in a research study, please ask the researchers if they will be using the core outcome set.
By using this core outcome set around the world over many years, we will be able to compare the studies that are published. Improvements on research will help us improve treatment for children with CP, like Chloe.
Please tell your friends and family about this research.